It's great to feel like you're a part of something. I think as an entrepreneur, a lot of times you feel like you're a band of one, trying to solve all the problems in the world, and I don't feel that way with this group.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here on the floor of the American Diabetes Association annual conference with my friend Bill Ervin, the CEO and founder of Bulsai. Bill, great to see you.
You too. Thanks for having me.
So let's start by just understanding what Bulsai is. I understand it's an innovative product for folks with type 1 diabetes.
That's correct. What we look for is proper placement for injections and for infusions using AI and other technology to avoid scar tissue, lipohypertrophy, and really helping the lives of people with diabetes and better absorbing insulin.
And why do you care about this issue?
I care about this issue because I've had T1D for 38 years, and 3 years ago, I went to my endocrinologist and said, this is ridiculous. I keep hitting bad spots. At that time, I didn't know what LH was. And isn't there like a portable device of some kind that you could use to actually find healthy tissue before you inject? And she said, no, that's a really good idea. And if you ever do anything with it, then let me know. So,
what was it about your background that made you think, well, maybe I'm the guy to do this?
I've been a part of 6 different startups, had a successful exit in the early 2000s, and I've always been an entrepreneur. I've always been in business development and sales, so I felt that was a pretty good component. Not the greatest scientist of all time.
Break down the challenge. You said LH, you used some technical terms there, so walk me through the life of being a type 1 diabetic and the challenges of finding the right spot for insulin.
So as you would probably think, anyone who is either using an insulin pump or using an insulin pen or syringe is taking tens of thousands of injections over their lifetime. And what happens is, for some reason, we all kind of repeatedly inject in the same place over and over and over again. And what happens is it causes a buildup of scar tissue, also called lipohypertrophy or LH. And so that is something that when you inject into it, you are unable to absorb the insulin. And so it's kind of like if I was a doctor and I said, Logan, go home and take these 2 pills every day, and you took 1 every day. I mean, would there be an adverse effect to your overall health? And since this is a disease that is self-administered every single day around the world, we need to make sure that everyone is getting the correct amount of medicine that they need in order to stay alive and not have, different terrible events that lead you to hospitalization and ER visits and death.
Oh, it just makes me think about the divide in innovation. There's folks who are innovating on types of insulin and glucagon, all these things, and then you're talking about, well, we got to at least get the medicine into individuals and make sure there's not a blockage. So like make sure that they're getting access to the best medicine they can get. Talk to me about the actual technologies that you'd like to bake into the Bulsai device.
So we want to use infrared because that is completely non-invasive. It's basically a device that could be battery operated, could be very small and portable, which is important because people are doing injections in restaurants, at the golf course, anywhere. It's completely non-invasive, like I said. It's kind of a red light, green light. So we're really looking for healthy tissue. We're not really looking for LH or scar tissue. We're looking to avoid that. But it's something that's very easy to use, and there's no diagnostics going on by the patient at all. So we want simplicity and at a low cost if we can.
Okay. What stage are you at, and what does the next, let's say, 12 months look like for you?
So I'm very excited. I just brought on 2 people to my executive team. I now have a chief administrative officer who's helping with regulatory compliance, funding, and then I have he's an attorney, and he also has an IP background. Then I also brought on a COO who was a past CEO, retired, who's going to help me with business development, product development. And I'm also adding to my advisory board. I just found a great endocrinologist who is going to join my advisory board. And I'm also talking to some people at universities about joining as well. So I feel like the team is really coming together. I'm very excited about that. Next steps are to build a prototype, do some more studies on tissue itself to identify what's the difference between healthy tissue versus scar tissue. But I feel better about my company today than when I started it 2 years ago.
Okay. You've been a part of the T1D Moonshot. I think, have you presented at the Impact Board?
Yes, I have.
You have. Okay. Tell me a little bit about that experience, and have you had any sort of positive response from being in a community of like-minded folks?
Yes, so I did my SWOT analysis at the Impact Board back in December. Got some great feedback. Got some great pushback, which is great because you don't want people to tell you how great you are. You want to get some constructive criticism. And so I learned a lot from that. Actually made a pivot from ultrasound to IR, infrared, based on that conversation.
That's a big pivot.
Huge pivot. And another thing I didn't really mention is that ultrasound is much higher cost, and the user experience is much worse by putting some kind of gel on your abdomen and sticky and messy, and it's just problematic. Yeah, and I also learned, or I made great connections with that. I've also gone forward and I've had great conversations with some of the people on the board. And then they've connected me with other people in the industry, some industry leaders, so some thought leaders, and and then as far as other people that are on the T1D Moonshot, a lot of them are here today, and I've got a chance to meet them in person. They have connected me with all kinds of people. We were actually problem solving for one of the other founders yesterday about his product, and so it's great to feel like you're a part of something. I think as an entrepreneur, a lot of times you feel like you're a band of one, trying to solve all the problems in the world, and I don't feel that way with this group.
I actually saw that moment playing out across the room. You were talking to Ole Nielsen from GoPen. Can you just describe just generally kind of what happened in that moment and why it was special?
It was great because he had pulled out his glasses and he had built a label to go onto his syringes that was very small writing. And I said, why don't you just color code it? And he's like, that's a great idea. We could color code it because then we wouldn't have to be able to read it. And a lot of people are older with diabetes who can't see as well. It was a neat experience. I mean, it seemed like a basic thing to me, but
And that could actually help him move towards FDA, and that he was actually struggling with a real challenge. Bill, it's been exciting to watch your progress. That shift to infrared is fascinating, and the fact that it came out of a community conversation is so cool, and that you could give that feedback to Ole yesterday is just sort of icing on the cake. So great to see you, and we're going to be watching your progress for the next year.
Great. Thanks, Logan. Appreciate it.